Understanding ECG interpretation and heart rhythms is crucial for nursing students preparing for the Nclex. Here's a concise guide covering the fundamentals. Basics of ECG: ECG waves, P wave, atrial depolarization, QRS complex ventricular depolarization, T wave ventricular repolarization, U wave possible repolarization of the Purkinje fibers, though it's not always present. Intervals and segments. PR interval, time from the start of atrial depolarization to the start of ventricular depolarization, with normal being 0.12 to 0.20 seconds. QRS duration, time taken for ventricular depolarization, normally less than 0.12 seconds. QT interval, time from the start of ventricular depolarization to the end of ventricular repolarization, usually less than 440 milliseconds for men, and 460 milliseconds for women. ST segment, time between the end of ventricular depolarization and the start of ventricular repolarization. Atrial fibrillation, irregular rhythm, no distinct P waves, instead fibrillatory waves, can lead to stroke due to clot formation. Atrial flutter is characterized by a sawtooth pattern of P waves, also known as F waves. It can present with either a regular or irregular ventricular response. Additionally, it can lead to thromboembolic events, so it's something to watch out for. Ventricular fibrillation, often abbreviated as VF, shows a chaotic and irregular ECG pattern. There are no identifiable waves, making it quite distinctive. This condition is life-threatening and requires immediate CPR and defibrillation to increase the chances of survival. Ventricular tachycardia, or VT, is defined by 3 or more consecutive PVCs. It can be either monomorphic or polymorphic in nature. If left untreated, Vermont can progress to VF, which is why timely intervention is crucial. Premature ventricular contractions, or PVCs, are early QRS complexes that appear wide and bizarre. They can be unifocal, originating from the same location, or multifocal, coming from different origins. Steps to interpret an ECG include the following. First, determine the rate by counting the number of R waves in a 6-second strip, and then multiply by 10. Next, assess the rhythm by checking for regularity, measuring the distance between RR intervals. Then, examine the P waves. Are they present, and is there one for every QRS complex? Measure intervals such as the PR interval, QRS duration, and QT interval. Identify QRS morphology to see if it is normal or abnormal. Finally, form an overall impression. What rhythm do you see? Is it normal, bradycardic, tachycardic, or arrhythmic? Here are some common Nclex tips. Recognize life-threatening rhythms like ventricular fibrillation or pulseless ventricular tachycardia, which require immediate intervention. Understand treatment protocols, including guidelines for CPR, medication administration such as antiarrhythmics and defibrillation. Memorize critical values, knowing normal ranges and critical thresholds for heart rates, intervals, and rhythms. And practice with ECG strips to enhance your ability to quickly identify rhythms under timed conditions. In conclusion, ECG interpretation is a skill that combines knowledge and practice. Familiarize yourself with common rhythms and their implications for patient care to excel on the Nclex. Use practice exams and quizzes to test your understanding and reinforce your learning.